I guess our conversation for kindness and real emphasis on the word art at the beginning. This is has sort of emerged and is really clear to those of us who've very gently had our hands in and around the steering wheel. Is a movement, is a community of practice, is a group of friends and colleagues who trying to come together and learn and think about how we can collectively have a bucket load of impact. We've been meeting on the third Thursday of the month. I think this is the first one not on the third Thursday of a month now for 3 years. And the aim has really been to try and create a very inclusive space where people can come together. I think with some really key actions, definitely to listen, definitely to learn, uh, to think differently. A lot of people have got in touch to say it's been a great space to recharge. So investing a bit of your own time, if you're Kath Crock at 4 o'clock in the morning, lots of us at the end of a working day, other people crammed in and amongst other things, Nikki bright and early in the morning in New Zealand, and everything in between. But actually also to think about how do we use that recharging as a bit of a mobilization for action, for doing stuff, for making stuff happen. Um, and I think also it's given a really strong focus on sharing of resources and energy and ideas. And I've loved it's been an we've not measured it, but it's felt like a really big thing that lots of different people have connected up round the side. I mean, Chris Turner being across, down in Melbourne, it wasn't necessarily this call that made that link. Maybe it was, but I think that ability that people have got to connect with each other and share and build a sort of collective power, and that's been really cool. So I just wanted to also out and thank. There's a whole load of people to thank, but the guys named on here are a little rather wonderful crew across 5 countries, if I've done my maths right, who do go a bit above and beyond to try and make these things happen. So I know quite often I end up sort of fronting a bit of the conversation, but I'm quite firmly at the bottom of that little list for good reason, because I think there's just this amazing group of people who are whirring away and trying. Realistically, we're pretty light touch about it because we've all got lots else on, but we all think this is super important. We all get great energy from being with you, and I guess I want to say a particular thanks to everybody named there for your support and inspiration in keeping this going. um a next set of thanks is to everyone here. Now, if you're from a country that's not listed here, please get in touch. I need to put my number up. But we've had this extraordinary response and new people getting in touch all the time. And, we had Haytham El Bashir on with us from the United Arab Emirates last time round. And we constantly have people from different places. And those of you like just watching Alice popping up on the chat, joining for the first time, you're so welcome. And it's just great to get this sense of being a really international community where we're trying to work on this stuff together. So what are we working on and what have we been learning? And I ran a few sessions with Shane and George from the amazing Kaleidoscope team through the summer, with Maureen and Yoran and Nikki and Dom, James, Susie, Gabby's on the call as well, and others, to really think through where we got to and what is this all about and what strategic choices might we want to make going forward. And reflecting on that, and we did a bit of work on a Jamboard. I've been through this, so actually Maureen and Nikki and others haven't seen this. No one's seen this. This is the latest version, so this is very much for us all to think about and share. So these are 9 themes that feel like they have really bubbled up, if you like, to the front, and we'll get on to a bit of work about maybe which are the ones that people think are the most important or really resonate. So there has definitely been this first one about kindness being a choice of action. I think if you go back and read the wonderful John Ballot, John sends apologies. He's heading off to a wedding in France, if I remember the email right. But John's wonderful book about intelligent kindness sort of frames kindness in this way. This idea, this is an action. This is an active doing thing. And therefore inherent in that is a choice. And therefore one can get a bit curious about where unkind actions are happening and what might be going on there for people. So there's a piece about kind behaviors as effective an action as anything in creating psychological safety at work. This idea that none of us have actually yet to find a better tool than the action of kindness in creating psychological safety. And just putting a little trailer in for next month, rather wonderfully, we haven't got Amy Edmondson with us tonight because she's doing a talk for colleagues at the IHI. But Amy, who from what I can see is the leading academic on that in the world on psychological safety, is coming to share next month's session. So we're going to be exploring that with Amy, but that feels really important for us. I'm rocking up on the wards at St Mary's tomorrow morning for a 3-day stint, and that's top of my mind. How do I create psychological safety? Maureen, come on in.
I just want to add that if you have an opportunity and you haven't already read her book, it's called The Right Kind of Wrong. And when I'm reading a book, if I have a comment or a thought when I'm reading it, I write it on the inside. And this is how many things I wrote. The entire first 3 pages are filled with comments and reactions. So if you get a chance before our next session to read her book, I would highly recommend it.
Oh, Maureen, so wonderful. And listen, we'll look forward to you getting really interactive. And listen, isn't it wonderful to have people like Amy coming and joining the community, helping us learn? So that really leads on beautifully to the third one. Is there is a growing evidence base. And there are many people on this call looking down the list who have been absolutely working incredibly hard to generate that evidence base on the impact of kindness on patient outcomes and staff well-being. And that's exciting and important. And I think is a big reason why we all come together to say, look, this is not soft and fluffy stuff. This is stuff that counts. This is stuff that really matters. There's a really key piece about leading with kindness being central to work to reduce staff burnout and creating inclusive workplaces. I think a lot of us have used this time together as a way, as we touched on, to recharge and replenish. But there's an important piece about how we think about that among the teams and organizations and systems we all lead and are part of. There's definitely this piece about systematically challenging unkind behaviors, but also being curious about what's going on. And I want to give a shout out actually to Gemma Gilbert's a wonderful friend and colleague, works in London, does a lot of amazing work around street health and other all sorts of other things. And Gemma was talking a bit about the sort of the need for compassion in where one sees unkind behaviors and recognizing that the source of unkind behaviors will come from actually really good, thoughtful people who are struggling, who have got difficult things going on. And how do we both tackle it in a hard, clear way that it's unacceptable, but exploring that with some kindness, with some support as well. There's a really key piece, and Maureen, you've been really leading the charge on this, that we've got a hunch, haven't we, that a really key lever for change is that if we all really get behind how we transform the teaching, training, learning of our current and future workforce, feels really critical. I think we're very minded to think about putting some energy and investment and resource behind thinking about curricula, thinking about learning materials, thinking about assessment, whether it's for our future nurses, physicians associates, doctors, managers, anybody working in health and care. That feels like a biggie. And there's a big piece here about measurement, and I've got into some interesting discussions today about equality, diversity, inclusion. There's our Secretary of State for Health in the UK sort of hit the press for putting out playing some culture wars around jobs around equality, diversity, inclusion in the National Health Service, and basically saying they're worthless, and really trying to play to a base set of voters that this isn't worth doing. And the backlash he's received across a number of different people, some of them who you'd expect to be tough back with him, but others who you wouldn't, has been rather wonderful to watch. And I think central to that, and I'm fascinated by this power grab that we have. So follow this logic with me for a minute. You place importance on things we measure, all of us in our organizations and our systems. And I hear this narrative all the time where people go, you can't measure trust. Oh, Bob, you can't measure culture. You can't measure kindness. And as we learned from Simon Brownlee about 2 years ago, who ran a session, and I think one of the things Maureen and Nikki and Kath and Dom and Susie and I are keen to reboot is revisit that. And Simon led a wonderful session with us where he first of all challenged us to think, do we really want to be measuring kindness? But if you do, you can think about the conditions for kindness and how you measure them. You can think about activities and inputs that may well lead to outcomes of kindness. So I think there's this real idea that this is definitely measurable, and we need to perhaps be a bit more bold about challenging some of the thinking that you can only measure money, or you can only measure widgets, or you can only measure things, and therefore too much importance gets put on them. There's this beautiful asset-based thing. Kindness is a cycle. Being kind stimulates more kindness, which then grows the impact. Maureen always makes the wonderful point is there's an inherently almost sort of a self-benefit that being kind and generous leaves you feeling a little bit more upbeat around things. And this idea that actually, if you make kindness a starting point, that is a critical base for work that you might be doing around improving quality, improving safety, improving equity, indeed around productivity. So these 9 themes have really bubbled up. And here's the thing, what I'd love you to do, I just wanted to flag as well, and with thanks to a lovely friend, Matthew, who has been really a key ally in this work and leading What Matters to You work with others, and Maureen as well. And we have a website, kindnessinhealthcare.world. It's pretty rudimentary. The wonderful Kaleidoscope team help, and Tamara's just come on the call as well. And the What Matters to You team have a fabulous sort of sister website as well. It's basic. We try and use it to share resources to sort of spread the word around, and the wonderful Kaleidoscope team have been helping us. I'm sure there's more we can and should do. If anyone has got expertise, wants to come and get involved, wants to write some blogs and things, please do. But listen, I want to get onto some work with you all. I'll put the 9 themes again in the chat, but I guess my question is, which of those 9 emergent themes feel like key areas we should collectively focus on? What are the activities and inputs and I guess I say we as individuals, but also as a community, might want to co-produce? And I guess the second question is, how might we want to evolve the way the community works and learns together? Thanks so much, Anna. That's super. We've got ourselves into a rather amazing place just in an emergent way, but maybe we should be a little bit more deliberate about what we do, or maybe we carry on in the same sort of way. I'm really keen to get views and thoughts, because ultimately this isn't my decision or Kath's decision, or this has to be all of us together, coming together. So I'm going to attempt in a minute to go to some breakout rooms. Let's see what happens, and I'll stay in the main room, so if anybody gets lost you can come back and see me. Let's see what happens, and I think we'll see you in about 20 minutes. I've got lots of wonderful smiling faces. I've sort of had an extraordinary sensory experience of the little group that I was in. I had the wonderful Gabby's been busy working away on a risotto, and I could sort of see the steam coming up, and it's going to be good. If any of you are kicking around North London, I'd be knocking on Gab's door. And, but listen, some amazing discussions, and listen, we've got 15, 16, 17 minutes. I know you've all been getting stuck into all sorts of conversations. It would be lovely to hear from some of them. So look, as usual, some of you guys are on the move or would rather have a sort of quiet approach. We'll be keeping an eye out the chat, but I know that there's some wonderfully eloquent, thoughtful people who love to sort of share some thoughts out loud. It'd be great to hear from people about some things they're talking about. And from our little group, in a minute or two, I'm definitely going to invite Dom and Manoj to come and say hello. But come on, I don't be shy. I've got some lovely extrovert friends on this call who fantastic. To her, you're a leader on this front. Come and say hello, and we know some other hands will come up.
Yeah, thank you. No, I think I was with Catherine, who's burning the post midnight oil at 2 o'clock in the morning in Melbourne, and with Darren, who's in the Cornwall area, and I from Blackpool. So we are forming a nice, a scalene triangle, if you will, in geographical terms. Uh, obviously, Catherine already has a website going called Gathering of Kindness.org in Australia, and they were telling me that they have a big activity coming up in November. So the only kind of the what do you call the bump was that people have to buy tickets to get into this event, and they said that, I mean, why don't I let her talk? Catherine, would you like to come online?
Kath, listen, you've got a northwest of England agent here now.
Oh dear. Yeah, so Taha was
Come on, listen,
saying,
Kath. In all seriousness, what you do and what you're doing is absolutely amazing. So please, and it's great timing, isn't it, to let everybody know. And in a minute we'll get you to post some stuff in the chat. But do tell us a little bit about what you're up to with the gathering.
yes, so this weekend we've got an in-person gathering of kindness in Melbourne, which is right up close to the IHIBMJ Quality and Safety meeting. So there's going to be quite a focus on kindness in Melbourne over the next couple of days. And then in November, we've got a series of online events. And yes, people do have to pay to join online, but I was explaining that it's really expensive even doing the filming and getting it together. So Taha was saying, well, then you need celebrities or philanthropists to help support some of this work. So that was really nice. But everybody is welcome to join the online events and join the conversations because they're interactive and they're really interesting and creative. We use the arts to tell the story for most of what we do. So
Amazing.
thanks,
Kath,
Bob.
yeah, listen, and thanks so much, and good luck with it all. And it's been an absolute pleasure and privilege to learn about your journey and all the work that you're doing and join forces with it. Talking of joining forces, one of the other wonderful things about this group has been all the learning across different people doing things. You've got Chris Turner with you, fast asleep in his Australian bed, who leads Civility Saves Life. But Damara, wonderful to have you here, and everything that we've learned from all the work that you've been leading with a wonderful group on What Matters to You. But I'm sure you've got some thoughts on that and other things as well. Come on in and let us know what you were talking about. You're just on mute, Damara.
Thank you. Hi, everybody. So I had a great group. It was Simon, Rachel, Lisa, and Claire, and we were reflecting back on the different themes. And the themes that resonated with us were kindness is a choice, and you should role model it, and including kindness to ourselves. Simon talked about the ripple effect and how kindness is cyclical. If you put kindness in, you get kindness out, and it grows, and other people can feel the downstream impact. The ripple effect is usually associated with negative, so it's about shifting it so it becomes a kindness ripple, which I loved. And then I stressed about the importance of like really developing an evidence base for kindness and for what matters to you, because in this world nowadays, if there's not a return on investment and demonstration that it actually leads to outcomes, it's really hard to get funding to actually implement programs that are so important like this. We talked about different actions that could support some of these. For example, publications, there's such amazing work going on around the globe, but not everybody has the capacity or the knowledge of how to put it together into a publication. So perhaps there could be a way to nurture folks to write up their QI work and to develop that evidence base. We also spoke about how social influencers like at TikTok could help spread kindness in the same way like we spread other challenges on TikTok. And then lastly, we talked about how there's a real love of this meeting and the What Matters to You meeting that occurs monthly, and it really is a place that we all look forward to coming to, because you're connecting with people, and so there's a wish not to distract from that and break into smaller groups, but still have some cohesion in the larger group.
Amazing. That's so cool. And listen, I don't think I explained it very well at all. The bit on measurement is just to sort of confess where I'm at I'm on the attack around measurement. So I've spotted this thing that we have got that the idea the stuff that gets measured is the stuff that people pay attention to. And there's a whole bunch of people who are focusing the power of that on money, on activity, on widgets, and perpetuating this narrative that you can't measure culture, you can't measure inclusion, you can't measure equity, you can't measure kindness, you can't measure what matters to people. And I, frankly, as a mixed methods researcher, that's just not true. And but we've sort of allowed that narrative to develop a bit, and I'm hence getting feisty about it. So if anyone says to me, "Oh, you can't measure culture," they get quite a strong evidence-based response. I'm also interested in how technology, so if you think about all the stuff around large language models, neurolinguistic programming and stuff, I think is going to start to open up much more access to more qualitative research. Think about all the qualitative researchers on the call who were doing stuff 10, 20 years ago and cutting out pieces of paper and rearranging them. There's a different opportunity there. Miriam, it's so lovely to see you. And for those of you who don't know Miriam's a wonderful friend and fellow paediatrician who's also led an incredible patient-centered session with some of her colleagues from PICU in the depths of winter last year. Miriam, come and say hello, and it'd be lovely to hear what you and your group were thinking about.
Thanks, Bob. Yeah, so in our group, we discussed some of the themes that have already been discussed about the importance of. We actually talked about two main things. One was around kindness being sort of top down and role modeling in kindness, and the importance of leading with kindness. How that culture gets spread through the people who are in leadership positions, and it doesn't need to be sort of huge gestures and huge acts, but actually small acts of kindness make a big difference and impact on the way that everyone else behaves. But one thing that that I was considering and thinking about, and we discussed as well, and I think it would be interesting around measurement. It doesn't fit very obviously into one particular theme, but just wondering about investigating barriers to kindness, because I wonder, why is kindness not the default? Why is it that kindness isn't something that we just is just part of the culture anyway? And I've been thinking about that as part of this group, and we were exploring in our group some of the reasons why that might be. Is that related to role modeling, as in it's not traditional that people role model kindness in healthcare settings? Is it the fact that people are that kindness is associated with fluffiness and niceness being sort of a lack of robustness? Is that mean you're not clinically good at your job if you're kind? It's sort of you're being kind to cover up the fact that you can't do what you're doing. Or is it people are scared that if they're kind, then that opens them up to people being more demanding of them, either demanding of their time that they're prepared to give or demanding of them emotionally. So I think it would be really interesting to explore what the barriers are to kindness and why we even have to have this conversation in the first place. Why are people not kind? And what can we do to help facilitate removal of some of those barriers?
Yeah, super interesting. And your curiosity around that lit quite a lot for me. I posted in the chat the wonderful work that Simon Anderson, Julie Brownlee did around measurement. And one of the things that Simon talks about is the measurement in and around the conditions. And as you were talking, Miriam, I was sort of thinking about conditions that promote, but actually also conditions that get in the way. Use the word barriers. Yeah, listen, I love it. Something we should definitely get onto. The hands are flying up. Taher, come on back in. Something's obviously triggered for you, and then let's hear from Essie and Katerini.
I'm sorry, I needed to come back. It was about the measurement of kindness that you were talking about. And during our chat with Darren and Catherine, what I conveyed, and I hope everybody likes this idea, is that even if you can't measure kindness, you can definitely measure the impact of kindness. And I was saying that sometimes the smallest act of kindness can make the hugest impact. Assuming, for example, say that there is a new international medical graduate who's kind of feeling extremely isolated and wants to leave work. And just a simple act of talking to them or taking them out for a cup of coffee, which is going to cost you only a couple of pounds, may actually make such a huge impact that they might begin to like the NHS. I gave the example of somebody who's standing on a bridge and is about to end their life, and you just hold their hand and give them just a kind word, and that might make the difference between life and death. So I think the impact of kindness is something that you can't really measure in a simple way. It's the intent of how kind you are, the sincerity of how kind you are, which will make a more significant difference than the actual magnitude of the kindness that you deliver. Thank you.
Thanks so much. So really interesting bit about the amplification effect that's been touched on. Listen, great stuff. I'm loving all the hands coming. Let's hear from lots of people. Essie, come on in and say hello. Lovely to see you. How are you?
Great, thank you. So great to be here. And I won't go over the myriad of things that have already been discussed because there was a lot of homology in the group we had, which was with Jane Anderson, Hess, Charlotte, and Akudo. We talked, one of the things we wanted to highlight was the question about health inequalities and whether health inequalities are perhaps driven or underpinned by unkindness, and how interesting and important it would be. I wanted to come and feed on from what Mariam was saying, really, in relation to what are the barriers to us being defaultly kind, and how does that feed into health inequalities. We also talked about how, on the one hand, we really love the breakout groups and the brainstorming and the discussions that we have on this platform. And it would be, we weren't sure whether we were missing out on something, or whether there's a repository for the outputs of all of these discussions, because I'm one of those kind of greedy people that's also loves my group, but also kind of wants to know what's happening in every other group and what's everyone else talking about. So there's that sort of that shared element. The final thing was somebody raised the question of whether there was space in this group, these platforms, to bring a problem. Sort of the agony aunt model was sort of mentioned. Somebody might bring a problem that they've been grappling with, and that might be worked through as a sort of a worked example, share thoughts and experiences so we can work together to tackle some of the challenges that we might be facing.
Yeah, listen, absolutely wonderful stuff, and loads of things to think about, and really appreciate the sort of thoughtfulness that you guys as a group have put into sort of how the community sort of best works. I think as an educationalist, one of the things I sort of learned lots about was learning styles, and definitely different people. A couple of times you've had technical problems where the breakouts haven't worked, and that's been, we've been fine and we can adapt, but if quite a few people just gently got in touch to say actually they really missed the breakout, they missed that smaller group. Listen, wonderful stuff. I love the FOMO that you describe as well, about missing out on things, and probably a bit of FOMO is a bit healthy, I reckon. But look, great call, and I'd love us to get a bit better. I'm trying to find I put out a bit of a pitch to Health Education England, so I'd love to find a fellow who could help curate some of this stuff. I think it'd be a really fun year. I did a couple of fellowships and training to come and get central to this, because the reality is all of us at 2 a.m, whether it's Kath 2 a.m. now or me 2 a.m, trying to pull this together, are never going to be that brilliant at it. So we definitely miss things. So look, thanks so much. Really appreciate. But any thoughts and ideas? Emma plus family, I think. Up in Yorkshire. Emma, come and say hello, and it'd be great to hear. And then Katerina, we're going to come to you next.
Yeah, hi. It was just a comment really in response to what Miriam was saying, and I suppose almost topical, seeing as I have a small person on my lap. But I've been listening to a podcast, and it was when Miriam said, why isn't it just natural for us to be kind all the time? Why is it the thing that kind of it's an effort? And I think that as children or as parents, we encourage our children to be kind to their peers and be nice, and if you are kind, then you're a good child, and then suddenly at some point there is a shift from childhood to adulthood and going into the workplace where it's not seen as a positive anymore, it's suddenly seen as a negative, and that you might be a bit of a pushover if you're that nice, kind person. So then suddenly we have to act that we aren't that pushover, and I don't know, I'm not sure at which point it becomes unnatural to be kind, because as children we are, and also as an adult it's then exhausting. You're going to work and you're trying to be this sort of person that that you're perhaps not, and then you go home and you're again trying to promote the kindness at home. So why aren't we just doing it?
Oh, Emma, you've just gone on to mute. You've just at the very end gone on to mute.
Sorry, I think she pressed a button. Just why aren't we just kind all the time?
Listen, and I mean, we need some experts in sort of anthropology, and so you and Miriam are onto something super interesting there. And there's been a really interesting bit. Some of you will have seen in the BMJ over the summer. Nikki, maybe we're running out of time, so but some really interesting stuff around gender around this as well. So we talked about through age and expectations around this. So listen, quick last couple of minutes. Katerina, you've been waiting for ages. Come on in, and then Dimitri, you're going to come and have the last word on things.
I just want to say, I suppose we have to work at it because we lapse. I think certainly what we do know is kindness is contagious. And if it can start from the top and people know this is our firm, this is our ward, we are all together, it's hard for everyone. So our nurses are with us and we're with the nurses and we're there for the patients. And I think the kindness to each other is a really huge part of being kind to the patient, because I think someone who's not kind to a patient really shouldn't be there at all, really, to be honest. So I think what needs to be worked on is our interpersonal relationships, and kindness should be a culture. And it's just contagious, because I'm just trying to kind of encourage that and see, we're a nice firm. We don't speak to each other like that. You can tell us, but tap us on the shoulder, tell us over a cup of tea. We are not like that, and if people are seeing that nobody's being tittle-tattled behind their backs, and that people can come forward and there's no blame and it's kind, I don't think anyone thinks we're pushover, because we're giving constant, that's the signal. You can't get away with that behavior on this firm. I'm sorry. And just, there's no reason to be. Now, I think looking at the psychopathology, now that's not so simple. Why does it happen? You're lucky if you've got kind children naturally, but I think they're taught to be polite. Children can be some of the most unkind things ever. So I think as human beings, we just need to keep teaching ourselves to be kind. Some people have a propensity to be like that, and some people don't. And I just think the rest of us who do, have to make that point. Actually, that's the norm and not the other way. I suppose I could go on for ages, but it's so lovely to have this group of people who realise.
We've just lost you at a key moment, but listen, thank you so much. That you've got a group of learners on here. That is for sure.
It's been nasty, and in my view, the best are the nice ones, because you don't need to be. Yeah, sorry.
Katerina, we're losing you a bit. Listen, we're out of time, but we're going to quickly go to Dimitri, who's been waiting for ages.
It's my theory in life that if you're very good at your
Dimitri,
hello.
Come on in, quick
hello,
30 seconds.
Yes, so it's good to be the last. I would just like to leave with a question about time, because we've been speaking about in our room about how surgery is not the kindest environment of all. And I think not only surgery, when you need to deliver, when you have a stressful situation, and sometimes time in terms of being kind in your relationship with colleagues, friends, and patients, it demands time. We are all stretched in the healthcare setting, and time as well in sometimes stressful, urgent situations demand the result, which is our aim to deliver the best for our patients. And sometimes there is no time to be kind on a stressful, urgent situation like an emergency operation or an intubation in ICU or an emergency setting with a very unwell patient. So I would just like to leave this as last time. How do we balance time and kindness on a positive way?
Yeah, no, great call. And listen, time is always, I always say that Bob phrase is time's not a thing. It's like where you put your priority around stuff. And I guess I'd frame that slightly differently to say, how we're saying the same thing. How do we make this a priority? And your point about the urgent situation is a great one. Listen, the joy of these hours, you can never solve everything. I hope it's been fun. I've learned a bucket load. I think scrolling back up, it was Bruce is smiling at me. I think Bruce has come up with a great idea about some sort of, I mean, I've had enough of pandemics, if I'm honest, but a kindness one I'm up for. Listen, thanks to everybody. Next time round, we've got the wonderful Amy Edmondson. We're going to be exploring psychological safety. It's going to be an absolute cracker. Please keep in touch. It's always lovely to hear from you all. Thanks for joining and for all your time. And have a great evening, morning. Go back to bed, Kath, and have a sleep. And I hope everything goes well with the gathering, and catch up with you all soon. Thanks as ever, everyone.